And so what I found when I was director of a region for one of the big groups, what I found was, unfortunately, because of what they were doing, which was kicking out the experienced clinicians to replace them with the juniors, they couldn't replace them easily because there's not enough vets around. And so they were running on locum power. And so the standard of locum can be from excellent, so don't get me wrong, some really excellent locums, right down to diabolical, some dreadful locums out there. And that is not good for general standards in practice. And we've lost too many experienced vets who are in the middle ages, not old, not geriatric like me, but, in the 40s and 50s who've sold out, taken the money, thank you very much, not doing very much. Now, the consequence of that, one of the main consequences then, is that there aren't enough people to see clients on a regular basis. So in other words, the traditional veterinary surgeon-client bond and relationship has gone. So now if you go to one of the big groups, particularly the groups, but some of the other practices as well, where they still can't get staff, you will not be guaranteed to see the same vet every time with the same case, which is what in my practice we always strove to do that. It would be very rare if I saw an animal with a problem I didn't see it the next time, and I would book it in to see me, not make an appointment next week, see me, when am I next available for you to see me, so I could keep continuity of the case. And that's gone in a lot of the practices now, which I think, and I'll give you a true example. Before I left the University of Nottingham, I was running a clinic with one of the finalist students, because how I did it was they did the consultation with me in the room, and then we'd talk about the case outside, and then they'd tell the client. So they did all the communicating with the clients, unless I had to step in and do something. Anyway, I looked at the cases before they came in, and one of them, I said to the student, how many clients do you think how many vets do you think this client has seen in the last 12 months with this dog for the same clinical condition? And she said, and I said, it's a lot. She said, I don't know, 7 or 8, so we'll count them. And this is true, I was going to be the 21st different vet to see that client with that dog for the same condition in less than 12 months, which is absolutely atrocious. And that's what's going on all over the country.
That's
I just think what we've lost relationship now. Yeah.
So okay, so
that's my worst concern is that.
Yeah, that's a dire situation. What's the solution?
Well, the solution is somehow practices, even if they're part of a group. So don't get me wrong, I sort of understand some of the motivation for having a large group, because of economies of scale. You can put in place, actually, if you do, they claim to do high level, work and putting in place procedures, what we call standing operating procedures, SOPs, which actually make everything run smoother and better and for the health of the animals. Of course, when you actually dig deeper, it's not true. They think they're doing that, but it's not what's happening at the ground level. So what needs to happen is these practices, they need to bring back the fundamental basic requirements of a good veterinary relationship with an owner, which is that you see a vet, doesn't have to be you, but a vet sees that client with the case, and then they try to ensure continuity of care for that animal. Because if it sees 21 people, I mean, even if we all said the same thing, we're all going to say it in a slightly different way. I know from the records that different people like to treat those conditions differently. So just imagine the confusion, that clients, every time they go in, they're being told something, even if it's similar, it's slightly different every time.